皆さん、こんにちは。
Hello, everyone.
ワールドキャンサーウィーク2024
Welcome to the World Cancer Week 2024. This year's theme is Empower Dialogue. Now I would like to
今回
begin.
はオープントーク
This time,
Stupid Cancer をお届けします。
we're going to have an open talk with
さまざ
stupid
まな団
cancer.
体の方に CancerX
Today,
コラボ
we
して
have
こ
several
の活動を
panelists
お知らせして
from several organizations.
さまざまな活動が広がっていくような
And
そういう
then
取り組み
I'd
で行
like
っています。
you to know about the opportunity to
今回は
collaborate with each
この
other
Stupid
from
Cancer の
the
CEO の
different
方をお迎えして
organizations. And then we have the representative from Stupid Cancer
トール君に
and other
そし
organizations.
てモデレーターをブリストル・マイヤーズ・スクイブのスティーブさんにお願いし
And
て
then
この
moderator
オープントークを
is
進めてい
done
きたい
by
と思っています
Mr. Steve Sugino
英
of
語と日本語の同時通訳でお送り
Bristol-Myers.
していきますので
And then we are
皆さん
using
は
the
画面
both
の
languages,
下あるい
English
は
and
上のところ
Japanese.
のボタンから
Audience, you will
ご自身の
see the
表現を
language
選択
button
して
at the
お聞きく
bottom
ださ
of
い
your screen,
ま
English
た
or
もし
Japanese.
この
So
セッ
if
シ
you
ョンを
would
聞い
like
て
to
くださっ
hear
て
the
疑問
interpretation
や
of
何か
the
聞いてみ
different
たいことが
language,
あった場合
please
には
press
ぜ
the
ひコメントをお寄せ
suitable
ください
language button.
相談者の皆さん
And
に
then
お
if
届
you
け
have
していきたい
any
と思ってい
special
ます
request or question, please use the chat.
それでは早速ですがこの
Now,
セッションのモデレーションをお願いしています
I would like
スティーブ
to
さんを呼びたいと
introduce
思います
Mr. Steve
ステ
Sugino,
ィーブ
the
さん、どうぞ
moderator of
画面
today's
をオンにし
session.
ていただけますか
Good
Steve,
afternoon, and thank you, Suzuki-san, or Misa. My name is Steve Sugino, and I'm the president of Bristol-Myers Squibb Japan, and we're a global biopharmaceutical company with a very long history in the cancer and oncology space, both solid tumors as well as blood cancers. And I'm very pleased to be hosting and moderating today's panel discussion as part of the World Cancer Week. We have two panelists that I'd like to introduce. We have Alison Silberman, who's the CEO of Stupid Cancer. And we also have Toru Kishida, who goes by Kishi. And he is, and from Cancer Notes, NPO, representative director, and an AYA patient himself. So if Alison and Kishi, if I can ask you to turn on your cameras, and maybe Alison, if we can start with you with a brief introduction.
Hello, everyone. My name is Alison Silberman. I'm the CEO of Stupid Cancer. We are a US-based national nonprofit whose mission is to help empower everyone affected by adolescent and young adult cancer by ending isolation and building community. Thank you so much to CancerX and to BMS for having me here and hosting this important discussion today.
Thank you, Alison. Alison is joining us from the United States. And Kishi, can I ask you to turn on your camera and to briefly introduce yourself?
Hello, everyone. My name is Kishida. Call me Kishi as a nickname. When I was 25 and 27, I had a germ tumor. And then at that time, I didn't get enough information about Medicare. And also, I need to have some life treatment information. So there are different cancer patients, so we could share each one's information. Then we will have a better understanding. So that's why I started my activity. So I would like to share some of my experience today. And then I'm AYA Oncology, AYA Academia Group, and I'm in charge of a PR. And I'm looking forward today. And nice to meet you all. Thank you.
Great. Thank you, Kishi. And we hope that through today's panel discussion, for those of you that are watching, that you'll come away from today's panel with a much better understanding and appreciation of the adolescent and young adult patient going through cancer, because there are some very specific and unique challenges and needs for this group of patients that oftentimes are not well understood, albeit whether it's in society or even within oftentimes the medical community. And so that's the objective of today's meeting. And hopefully through this, you'll be better understanding and hopefully also help us in advocating and joining us in helping to broaden the understanding and support for this important group of patients. So let me start, Alison, with you. If you can please tell us a bit more about Stupid Cancer. This is a very interesting name, and I'm curious if there is a story that you have that how this organization got started and how did it get its name and your connection?
Sure, absolutely. Well, I do have a couple of slides I will share, and hopefully you all can see this. Stupid Cancer is has been around now for about 17 years, and we are really about that irreverent tone and recognizing the unique challenges, as you said, of adolescents and young adults. And we like to say that we make AYA cancer suck less. As I mentioned, our mission is really about empowering the community and bringing the community together. And our vision is that everyone in this community is supported, understood, and accepted. Now, when I talk about AYAs, we are talking about 15 to 39-year-olds. And when I talk about our community, I'm talking about patients, survivors, caregivers, professionals, all of those serving the AYA community. We were founded back in 2007 by an AYA brain cancer survivor who was 21 at the time of his diagnosis. And when he was diagnosed, programs for AYAs didn't exist. And he, like many other young adults with cancer, fell into the space of being treated either as an adult or a pediatric patient, but never really fitting in anywhere. And the system failed to acknowledge the unique stage of life of an adolescent and young adult. And this made him mad, and this made him take action. And so Stupid Cancer originally started as a YouTube show and a podcast, bringing innovators in the healthcare industry, the nonprofit space, patients, all together to share their experiences and expertise in AYA cancer and elevating the voices of this underserved population. It really all started with storytelling. And when we were founded, we went through several iterations of names, started I'm Too Young for This, and Steps for Living, and then eventually landed on Stupid Cancer because honestly, that says it all, right? But over the past 17 years, we've grown through our award-winning and evidence-based programs to help change the landscape for AYA cancer in the United States. Our programs are both online and in person, and they focus on creating connections for this largely underserved population who are facing isolation and real mental health challenges by providing pointed information specific to their needs, specific to the needs of this unique population who are facing diagnosis at a critical stage in their emotional and professional development. And to share a little bit about the experiences of AYAs, and I know Kishi can get really into this as well. Again, we're talking about 15 to 39-year-olds. And in the United States here, we see about 90,000 new AYA diagnoses every year. There's about 1.3 million worldwide. And so here in this country, that's, hundreds of thousands living into survivorship. And that has a real ripple effect when you think about the caregivers and the loved ones affected by it. Cancer is the #1 cause of death by disease for people under 40 here in the United States. So it is a significant problem. And we also think about the AYA population as an underserved population. They're underrepresented in research because of lack of awareness or assumptions by providers. And really, there's not a lot of representation in the supportive or the clinical setting. Adolescents and young adults are more likely to receive a late diagnosis or be misdiagnosed compared to other age groups. And because, given their age, many patients and their doctors don't consider cancer as a possibility. And so this leads to a longer-term diagnosis. We hear that many AYAs have their concerns initially dismissed or minimized by their providers, which means it takes them longer to get to a referral to an oncologist, and that results in delayed treatment. And as we know, that can negatively impact their their outcomes. Some other considerations that AYAs face are financial toxicity. Many adolescents and young adults are uninsured or underinsured. I know a lot of that has to do with our different insurance systems here in the United States. We have a lot of private payer systems, but it also has to do with their smaller savings. This age group has less financial experience, and many AYAs face non-healthcare costs because of where they are in their lives, things like student loans or childcare that just exacerbate these financial challenges. Family planning and fertility preservation remain an under-addressed topic within the AYA community, and we often hear from people who come to us that say, well, I wish I had known when. I wish I had known the toxicity of my treatment. I wish I had known the impact on my fertility, and now it's too late. The exhausting demands of a cancer treatment during this critical period in development and growth has severe social emotional implications. Things that are happening already in your life, whether it's finishing school, starting college, career growth, starting a family, all of these have pretty significant social emotional implications that further isolate this community. We also talk about the treatment settings that are unfamiliar or uncomfortable. Like I said before, sometimes you're in an adult setting, sometimes you're in a pediatric setting, and neither is really designed for AYA's interests or needs. So again, these experiences lead to very real and damaging social isolation, which is compounded by the fact that their loved ones, their friends, their family may struggle to understand what those experiences are really like. Many AYAs in the US are treated in the community setting, so outside of larger academic institutions. And many of those institutions don't have as many AYA patients, so they have less experience with those unique challenges, and they have less access to those age-related resources that again leads to greater isolation. So we know that while more than 85% of AYAs in the United States survive the five-year mark, which is a great statistic, there are long-term physical and mental health side effects that many in our community have to contend with. Cancer never really goes away.
Great. Thank you, Alison. And it's very telling, right, about the needs and the gaps that we have. And as you mentioned, it's so the complexity, even within the healthcare system, as you mentioned, about the lack of research, about the clinical setting is not necessarily designed well for these the patients that are going through this. The social aspects of this, whether it's school or starting employment or starting a family and having to go through this. And so I think you've really highlighted many of the challenges that are not only in the United States, but I think globally as well. So we'll come back to you in a minute. Let me come over to Kishi. And Kishi, I was wondering if you could share with us a little bit about your story, and also after hearing Alison, any of your thoughts from what you heard about what Alison and her organization are doing in the United States.
Now, I would like to share my story. My personal background, as the patient aspect, and then hospital and academia aspect, and then administration, and then also involved in a school. And then today, my stance is a patient point of view. My activity is Cancer Notes. Cancer Notes is when I myself affected by the cancer when I was 25 and 27, 2 times in my life. And then the information I got those days were not sufficient enough, I felt. And especially the ordinary, how to lead the ordinary life under the effect of cancer as a patient. So we didn't have enough information in those days in Japan. So I felt very strongly to share this information and the knowledge among the cancer patients to share and then get the better understanding of our disease, the fight against the cancer. And then the long interview type, and then short interview type, and then we put this on YouTube. And this is the graph showing the demographic of the cancer patients. And then these are the theme-based video footage. And then how soon or when we should come out, or what we should tell people around us that I am the cancer patient. And then lack of sensitive information is a serious problem. And then we need to go farther from that. So my information I had was not efficient enough. So we need in-depth information. And then next step is patient talking with each other. And also another issue is the spread of the negative information. This is a serious problem. Sometimes there's a high stage cancer patient. For those people, this negative information is very has a very huge impact on those people. So we expect to show some patients who are role models in appearance. Then some people are leading the life with a lot of respect. So we'd like to share those information. And also, people, the cancer patients tend to be a minority and then isolated. So we have to solve this problem. And then we need to provide a place where the patients can connect. And then Aya Oncology Alliance in Japan, I would like to talk about a little bit more about this organization. Now we would like to work together and then solve the issues we face as a collaboratively. And then some of the members are medical doctors and then full of information. So we would like to work much harder from now on.
Thank you, Kishi. That was very helpful, and I could see many similarities between what you were talking about and also Alison. And I think, you know, the one thing that hit me was this idea of I wish I knew. I wish I knew, you know, this information, or I wish I knew I wasn't alone going through this, or I wish I knew, you know, there was a place I could go to connect with other people and get the information that I need, either for myself or my family. And so I hear a lot of similarities, and also using YouTube and digital technologies where this is, you know, where I think many of the AYA, you know, the patients or survivors are going for information. So it's really fantastic to hear all the work that you're doing. So thank you for sharing that. Alison, if I can come back to you, you know, it sounds like there's been a lot of progress over the last 17 years, but it sounds like there's also still many important gaps and needs. And I'm curious if you could talk a little bit about what your organization is focused on now and sort of moving into the future of what areas that you're focusing on, and perhaps some of the activities that you're doing to make a difference in those spaces.
Sure. Well, we know that there are new cancer diagnoses every year. And so our community continues to grow. And like Kishi had mentioned, and like I talked about earlier, the runway is long for AYA patients. Even in survivorship, there are significant challenges, and certainly fear of secondary diagnoses and relapse disease. So I think one of our challenges is making sure that patients know that there are people there who understand what they're going through, who get it, And that providers know that there are resources for young people and that adolescents and young adults have unique challenges. And these conversations that aren't always happening, whether it's around fertility preservation or how to advocate for yourself at work or school, those are all conversations that need to happen with this community in ways that they don't necessarily happen with older adults or younger children. So Stupid Cancer really tries to drive our mission home through two different pathways, through education and resources and through building connections. So through the education and resources, we have programs like our discussion series where we take these big topics like fertility or mental health, and break them down over a series of weeks to have an expert presentation with some facilitated peer-to-peer learning. That really helps to build connections as well. We also have our website is a huge resource. We have connections to other organizations, but also opportunities for patients to come to the website and dive a little bit deeper into some of these big topics. And whether it's rewatching a webinar or reading a story through our Stupid Cancer Stories program of somebody else who's going through what they're going through. The other big piece is the connections. We provide spaces for people to come together, both in person and online, to meet casually, to get away from the support group feeling and just be with people. And our big signature event is CancerCon, which is we do a digital CancerCon in the spring and a CancerCon in person in the summer. And those are both opportunities for people to come together to be surrounded by AYAs in a safe space, and as well as get a lot of really important age-appropriate, age-specific resources. But again, to your question about challenges, I think the biggest piece is that when we talk about AYAs, we're talking about several generations of people who have varying needs, and to your point, are very diverse culturally, racially, geographically, and that really begs the question: how do we share all of these resources? How do we really understand what this community needs when everybody's needs are different? And so Stupid Cancer really tries to provide different access points for our programs, for these issue areas. And we try to work with our partners, both in industry and in the healthcare provider side, to make sure that folks are talking about and learning about these unique challenges and the resources available to help these patients.
Thank you, Alison. And I can imagine, as you mentioned, the multiple different generations, thinking from a 15-year-old high school student, perhaps, as one group, and then when they go off to college, if those that do go off to college or start working after high school, to those that are moving away from home and typically away from perhaps when they start a new job or even going to college, and they're moving away from where they maybe initiated treatment or where they were treated previously, to starting a family. So it's quite a wide group of individuals at different stages of their life, even within this broader term, IA.
Absolutely. And I will add that the interesting point about this community is that, unlike other age groups, the caregiver, who is plays such a critical role with a patient, has the tendency to change over time. So if you think about, somebody diagnosed at 17, typically it's their parents. As they go through school, college, university, maybe it becomes roommates and friends, and then they mature, they grow, and it's a partner or a spouse. So that role and that support system is constantly changing as well.
So Keisha, as you're hearing a little bit about the priorities or areas that Alison talked about for Stupid Cancer, are there some similarities or differences from the work that you're doing for Cancer Note?
Thank you for asking. I see so many similarities and ぜひちょっと質問、アイソンさんにしたかったこと I would like to ask a question to Alison. 実は僕ですね、先ほど
actually,
オンラインでも活発にされているということで、
I heard
その前に
Stupid Cancer is very active in the
キャンサーコン
online
参加したことがあ
program.
るんです。キャンサーコンは、年に一度、大き
I
な
organized the Cancer Con, and then it is held
まあ、いろんなイベント
once
あ
a
りますけ
year.
れども、大きなイベントを、
And it's a big event in Japan.
かと僕認識しているんですけれど
And
も、
I realized
そ
that.
こで参加させていただいたりとか
And
する
then
と、すご
the
く、
first time I participated
皆
in
さんが
that
こう
event,
活発的というか、もう、
the
もう
participants are
すごく
very active,
なんか、エネルギッシュな
and then they are
雰囲気が
very
すごく見たり
energetic,
だとか、あと、まあ、すごく連携されている
and
なと
they
い
are
うところを
very
感じました。 一つその質問
positive
その
about their
キ
life.
ャンサーというですね、ネー
And
ミン
then
グ、僕は
the
実
naming
は
of the stupid
2014年に活
cancer,
動をスタートするときにですね、いろいろ
when you
情報を調べ
started
てい
the
て、実はストゥピッド
organization,
キャンサーさんを存じ上げていたん
but
ですね。
I knew
当
about
時
your
は
organization,
なんかす
Stupid
ごい
Cancer,
グッ
before.
ズなどを
When I
なん
first
か
started
販売
interest
されて
in
売
cancer
ったりだ
survivors
と
and
か、
then
そういう
higher
ふうに
generations
それも
cancer
グッズと
survivors,
かじゃなくて、
and then I
ちょ
ran
っと
into the name of the stupid
皆
cancer
さん
in
だ
the
ったりとか
past.
がちょっと元気になるような、ちょっと
And then stupid cancer is
なるよう
encouraging
なグッズがい
cancer
ろいろあったかなという
patients
こ
to
と
be
を
more
聞い
active
ていま
and
す。
then
ストゥピッドキャ
see
ン
the
サーって日
future.
本でそういう名前を言うと、ちょっとなんか、
And
おい
in
お前ふざけ
Japan,
てんの
we
かみ
if
たい
you
な、ちょっと
you
言葉が
use the stupid
ある
cancer
よう
as a
な
dialect
ところが
translation into
ちょっと意識して
Japanese,
しまうよう
sounds
な
very
感じ
awkward.
だと思うんですけれども、それに関して初めの
But
方、そのお名
have you
前
had
を発
such
音
a
に対してなん
reaction
か
from
い
the
ろ
general
んなご意
public,
見とかなかったですか？
the naming the stupid cancer?
I love that question.
面白い質問、いい質問ですね。
We do. And I think I will say that there are other organizations in the United States that have other names that I probably shouldn't say on this call. But yes, I mean, I think, it's very intentional because we want people to know that we're not stuffy and, we're recognizing that young people are mad and we want to make cancer suck less, and we're not afraid to say those bad words, and we're not afraid to talk about the stuff that people don't want to talk about. And Stupid Cancer was probably as PG as we could get while staying true to who we are and really how we feel about cancer and what the message is, and really helping to create that space that cancer is not great. Come join us and let's have it suck together.
めっちゃかっこいい。
Very cool. Sounds very cool.
やっぱ、なんでしょう。そういう意識的にそう
So you did that intentionally. So I was very impressed that idea.
本当に意識的に
So if you that intentionally and then make an appeal to the young people, then that's very effective.
ありがとうございます。
Thank you very much for your answer. I was impressed.
So Kishi, I'm interested if how do you think the Aya population in Japan would respond to not just the name of Stupid Cancer, but the spirit of that organization? Is that something that you think would resonate or connect with the Japanese Aya group or not?
ごめんなさい。もう一度お願いします。申し訳ない。すみません。
Okay. So I'm when Alison was talking about the naming of cancer, and also the word that she used was irreverent, and I'm not sure how to translate that in Japanese, but it's very I have 3 teenagers in my house, and so it's oftentimes very kind of free and very rejecting the establishment and wanting to have fun and be free and kind of do their own thing, and that's I think culturally, I think any country in the world, when teenagers and young adults have that sort of rebellion and that kind of feeling, But that idea of capturing that spirit with this group naturally who have this, but then also with cancer and having that feeling against cancer, and that how do you capture that feeling and use that as a positive as an organization and as a spirit of the organization. And I'm curious from a Japanese side if that culturally is relevant or it's very different culturally.
Well, thank you for your question. Well, in Japanese society, whether it's relevant or not, current situation, honestly speaking, it may be a little difficult to accept the general public. But CancerX, our organization, Cancer So What, is our basic concept. So in that sense, Misa, correct me if I'm wrong. Even our naming CancerX may sound strong, has some strong connotation. You're right. So cancer, so what is attitude? Sound, so what happened, so what? Is now, I wonder, I'm not too sure how acceptable in current Japanese society, the attitude, we said cancer, so what? This attitude is acceptable or not. So I'm kind of a bit afraid of, I cannot strongly say it's common or accepted. It's very stimulus sounds, but I long for the environment that the stupid cancer has been going through.
So Alison, question for you is, Kishi mentioned the CancerCon event. And I was hoping maybe you could talk a little bit more about that because, as Kishi mentioned, the positiveness and the energy and, the camaraderie that environment creates. And I know that that's tremendous amount of work and thought has gone into organizing that and planning for those type of events and how you create that environment. It's event. And I was wondering if you could tell us a little bit more about CancerCon.
Sure, absolutely. CancerCon actually started in its first days as a much smaller event. We're based in New York City here in the US. So it was a local event, maybe 50 people. And it just was a one day, bring people together, have presentations, sort of a standard conference. And as it picked up momentum, we had a West Coast, it was called OMG at the time. So there was an OMG East and an OMG West, and then it just sort of turned into its own thing, and we merged them and called them CancerCon. And the idea of CancerCon is it is a safe space. It is a gathering just for AYAs. And it was sort of born from this idea of we are all over the country, we are all over the world. And because it's a relatively rare to have a diagnosis within this age range compared to older adults, that often young people didn't see each other on top of all of the other things we've been talking about today about access to resources and lack of resources. But really just being in the same room with someone, and isolation being such a huge concern within this community, we decided to bring everyone together. Now, certainly the pandemic was a bit of a hiccup for everybody in the world. And we brought the event online and found that has been a really meaningful activity because we know that there are people that can't travel because of health reasons or finances or social anxiety. And so being able to access this event online has been really positive. So we continue, which is why we continue to do the two. But the idea behind CancerCon is that this is the place where you don't have to explain why you don't feel well, or why you might have an ostomy bag, or, any sort of side effects that you're presenting with, because everyone gets it. And you don't have to explain yourself. You don't have to apologize for yourself. And you're in a room where that sort of foundation is level for everybody. And that's really, really meaningful and really impactful for people. And we hear often that it is a life-changing event for a lot of our community because they've never been in the same room with a young person with cancer. So there's a lot of, when people share stories, there's a lot of, oh yeah, me too. Oh yeah, I did that too. I experienced that too, in ways that don't happen outside in the real world. So it's such a meaningful opportunity to bring people together, to show them that they're not alone. And the more people we can engage in this, the impact can really be huge for this community.
That's great. Thank you. Kishi, do you have any questions or comments as you heard Alison speaking about?
I
have so many questions or comments that I don't know where to start with. I'm wondering, now, in the United States, AYA generation, stupid cancer is dealing with AYA generations. Then how well spread the awareness of the existence of AYA generations in the society? And then you have organizing a CancerCon, and then that help the raising the awareness of AYA cancer, generation cancer patients. So what's the reality in the United States today?
I mean, from my perspective, I think the awareness is not high enough. Right. I think everybody should know this. And we do see that there are, in the larger academic institutions around the country, there's been a pretty significant shift of recognizing AYA as a thing, having AYA programs in these institutions. There was an NCI, a National Cancer Institute funded report that was released in the early 2000s, calling out the needs for recognizing AYAs, that I think really, it was a real sea change for the community. But at the same time, because we are such a large country, because we're talking about a rather small number in comparison to some other diseases, it's so spread out. AYAs are so spread out. And, because of the way our healthcare system works or doesn't work, and because of our insurance system, it really complicates connecting people to resources. And like we talked about before, financial toxicity being such a huge problem. Not having the funds to get to the treatment, to get to a different institution, to access a clinical trial, also sort of impacts that awareness and knowing what else is out there. So I sort of think about it as our work is not nearly done. Things like this and collaborations like this are certainly a step in the right direction. But as you probably know all too well from your personal experience, you don't think about cancer as the first problem, right? You go to the doctor and you think, oh, maybe I have a headache, or maybe I have growing pains, or anything but cancer. And I think that's prevalent in the United States as well. And I think that's where a lot of our work needs to happen.
Having heard that, in Japan, there are a lot of organization about the cancer patients. And then And then some of the members have passed away in 2 or 3 years. So the active members, the number of active members will decrease. That's the reality. So the continuation of those cancer organizations is another issue, another problem. So fundraising activity is very important, I understand. And then in order to focus on the continuity of an organization, and I'd like to learn more about the fundraising activity of the cancer, stupid cancer.
That's a big question. Fundraising, as you know, is sort of, it's not why we get into this, but it's very much becomes a big part of what we do. When we think about finding funding partners, it's really important for us to find like-minded companies, individuals, other partners to create true collaboration. Rather than just transactional partnerships. It's always nice to have the money, but I think what is more meaningful and what has longer term impact is how we're working together to make the change. How are we benefiting both parties to advance our mission? So that for us means a lot of companies that serve this generation, even if they're outside of the cancer space, as well as the disease types. We do work with a lot of great partners in the pharmaceutical industry to help raise awareness and to make sure that the AYA voices are heard in clinical trial development, in drug development, all of the things that they're doing. But it's really about closing those gaps in communication and elevating voices of AYAs. And I think, from that funding perspective, when thinking about where else you can get funding from, it's best not to boil the ocean. And that may be a very US centric idiom, but it really about picking a space and sticking to it. And I think that's sort of where, because patient advocacy and because nonprofit is such a huge part of our economy, there's a lot of competition. So staying really focused on it is really, really important for us. And, it's always interesting for me to learn how other folks do it, because obviously your economies and your cultures are so different. But where can we learn from each other, and maybe even where can we partner? Because the foundational problems for this community are global.
Thank you very much.
So Kishi, how is the situation in Japan with the organization and fundraising and partnerships?
In case of Japan, the fundraising situation is decreasing. Well, I'm just joking. But the reality is, in Japan, we don't have such a donation culture. So if we go out and ask for a fundraising support, we don't get the understanding so easily. So each organization has to generate their own profit, doing some profit-making programs. So in Japan, fundraising culture is not mature enough. It's growing, but still very slow. So I envy the situation in the United States or the stupid cancer's environment. Of course, each organization is emphasizing and then try to make it harder, work harder on fundraising activity.
And also, at the same time, they also have their own profit generating program. Some members have to work part-time or maybe sell some cookies, baked stuff, and then earn a little bit of money by selling the items. So we're facing the serious difficulty in case of Japan.
Thank you for that. Yeah, and I can relate to that. I think it is, Japan I found is people are very interested and committed to volunteering and wanting to donate their time, but the culture of donating money to various initiatives is still at the very early stage culturally. So I can appreciate that difficulty. So maybe as we're perhaps starting to wrap up here, Alison and Kishida, if you think about sort of what your dream is in this area of Aya, what's the kind of world that you would like to see in this space, and hopefully stimulate some thinking about what we can do together, or what, as we think about moving forward to different initiatives, sort of what that future world should look like versus where it is today. Maybe Alison, I'll start with you.
Sure.
そうですね。
I think about this a lot.
私はこれについてよく考えます。
I think that
私は思いますに、
I'd love to see the world
世界が
recognize that our providers are recognizing that AYA is a thing.
AYA の世代の人たちが非常に存在しているんだということを気づいてほしいですし、
And unique needs for this community, and
そ
that
してこの
when a young person is
コミュニ
diagnosed,
ティにおいて、
given the resources that they need, connections to those
そ
resources that
の
they
アヤ
need,
の世代の人たちが必要としているリソース、資源というものを 提
practical
供しても
or
らいたいですし、
so they can help,
で、
advance
お
through
互い
their
が助け合うことができるわけです。そう
I
い
would
う
love
こと
to
が
see more
実現する
collaboration
と。
in the United States and
アメリ
within
カに
all of our organizations across
Alison,
the
can I
world.
just pause you for 2 seconds? Tajiri-san, your translation is going over the English.
Oh, I didn't know if that was just me or.
No. Okay. All right, Alison, keep going. Thank you.
So I mean, I could just sort of repeat what I said. I think the dream is that we have a well-informed global society about what AYA is. So it's not such a so we don't have to deal with things like misdiagnosis or late diagnosis, that it's not such a shock that young people get cancer. I'm sure you all know, are hearing reports of these diagnoses that were typically older person cancers are now hitting people under 40. And so how can we get our societies to understand that these are happening with young people, and that young people have unique challenges and unique needs and need their own specific set of resources. And I would love to see us all working together to share those resources, to develop those resources, to get that word out, as well as to learn from each other. I mean, I think what you were sharing about the philanthropic community in Japan is really interesting. And so how can we help support what you're doing? How can we learn to help AYAs in other parts of the world as well? Because this will increasingly become a global problem.
Thank you, Alison. So Kishi, maybe from you, and if possible, I'd really be interested to hear from your personal, not as the NGO, but your personal self, as having been you're a cancer survivor and gone through this yourself. If reflecting on your own experience and what you want the future for someone who may go through this in the future, how different you would like that to be for that person.
My personal dream is that when I was under the cancer treatment, the medical people told me, see how it goes, or to see how the situation for a little while.
So I didn't get any critical information or sensitive information about my fertility or the family planning. And there is no book in Japanese, but there is a lot of books written in English. According to my interest, I found some very good books featuring some topics which I was very much interested in, and then the information I needed. But unfortunately, there's no Japanese translation of those books, or even not any doctors wrote any books like that. So CancerCon is very active and then can play a very important role in that aspect. And then I hope CancerCon in the States can influence the Japanese CancerCon or the people who are involved in the IS cancer survivors activities. And I work towards that direction much harder.
Thank you, Kishi. And thank you, Alison. Why don't we wrap up? And I just want to thank both of you. It was I learned a lot from today's discussion, and I know our audience watching this live now, and I think afterwards online as on a recorded session, that the new information about AYA and the challenges that this unique group face, not only from from clinical trials and late diagnoses, and so oftentimes falling between departments in hospitals or between pediatrics and adult, and just those practical challenges, but also the oftentimes the lack of information or relevant information in a timely and easily accessible place. Some of the unique challenges, as you talked about, for this group, going through adolescence and starting school or work or families, fertility, mental health, isolation, working with schools or companies that may not be accustomed to working with students or newly professionals who might be going through cancer treatment. And then also, Alison, you talked about the large survivor network as well, and how do we continue to support their needs as that group continues to grow, given the high percentage of those of survivors from cancers in the IS stage. So thank you so much, and I really ask our audience that not only I hope was this an educational opportunity to learn more about the needs here, but hopefully something resonated with you, and something, whether it's on the educational side or the medical side or the fundraising side, of where you can take a more active role and support Kishi and help support these organizations in Japan that are specifically focused on this AYA generation. So thank you all. And again, I appreciate everyone's attention and interest in today's session. And thank you especially to Alison, to you, and to Kishi as well. Thank you.
Thank you.
Misa.
Everyone, thank you very much sharing so many issues you are facing. And then today's session, and Steve, thank you very much for being the moderator for today's session. And Mr. Tajiri, for your interpretations. Thank you very much. Obviously, we are living in different countries and different regions. But speaking of the cancer, there is a common sense. And then World Cancer Week 2024, Empower Through Dialogue. I hope we could play an important role for those organizations working for the AYA generations, Stupid Cancer and the CancerX. I would like to hold the bright future for both organizations. And thank you very much for your participation today.
Thank you.
Great. Thank you, everyone. ありがとうございました。